Most of the times, what we speak about is our heart, our liver. Very rarely we talk about our kidneys. And it is very important for the general public to know how important it is to take care of the kidneys. So we have two kidneys. The kidneys are found in pair. So these two kidneys have very vital functions in our body, right from removing the impurities, the nitrogenous waste substances, to maintaining the equilibrium, homeostasis, and also the fluid balance. Apart from that, the pH of the blood, the ionic balance, synthesis of erythropoietin, which is responsible for RBC production. Along with that, kidneys are also responsible for production of calcitriol, which leads to development and maintenance of bone health. This is the reason we have to be taking care of our kidneys, because if any way the functions get disrupted, everything in the body goes haywire. Chronic kidney and disease. So chronic means it has been occurring since a long time. The patient may or may not have known about it. So as per the definition goes, if your serum creatinine is increased or on a higher side for 3 months or more, then you have been having chronic kidney disease. This chronic kidney disease could be due to glomerular reason, could be due to stones, it could be due to long-standing diabetes, hypertension, and so many other causes. So chronic kidney disease patients are again divided into 5 stages. A patient might be having stage 1 CKD to stage 5 CKD. This depends on how high your creatinine is, which indicates how well your kidneys are functioning when it comes to filtering the blood and removing the fluid from the body. So a CKD stage requires a periodic checkup so that we come to know that this patient is not progressing very soon to the stage of dialysis. A CKD stage 5 patient may do well on medicines for some time, but later on they sooner or later require dialysis or renal transplant. So these are the stages of kidney disease. So if at all you have been having high creatinine for more than 3 months, that means it is CKD. Now, the irony with kidney diseases is that we come to know about it when already the progression has occurred to a very large extent. That means, in a simpler term, if a kidney is functioning less than 15 or 10% in total, that is the time the clinical symptoms would come up. These kind of patients would have swelling in their feet. They might be having puffiness on their face, have high blood pressure, of course. They'll have anemia because kidneys, I've told, are responsible for blood production also. So they'll be having anemia and easy fatigability. They'll get tired very soon. These patients, if at all, have bone issues, they'll have bone pains, they'll have weakness, they'll be very predisposed to having pathological fractures. Also, if a patient has nephrotic syndrome, which might not be CKD or chronic kidney disease, but he has leakage of albumin from the urine, abnormal leakage, which is more than, say, 300 milligrams per day. So these kind of patients will have swelling on their face, on their feet. Some patients, along with this, might have blood in their urine, which is visible through naked eyes, or some patients will have microscopic hematuria, that is, blood is being lost in urine, but that can only be seen through urine routine and microscopy. So there are varied symptoms, but the problem is that we catch them very late when the disease has already advanced a lot. So we have to be careful when it comes to screening of these diseases, because if we catch these diseases at an earlier stage, we can curb the progression of the CKD. You have to take care that if at all you have a family history of diabetes, then you have to get your blood sugars checked periodically. You have to take care of your blood pressure also. After the age of 40, you have to get your blood pressure screened at least 6 monthly. If somebody who is young and they get hypertension, there could be so many causes of it, and then they should get evaluated, right from renal artery stenosis to glomerular diseases. There are n number of causes. So if you are younger than 40 and you have hypertension, then you should definitely get your kidneys also screened. So there are many things we as general public can do to take care of our kidneys so that we don't progress to the state where we need dialysis and renal transplant. The first and the foremost requirement is having optimal amount of fluid intake in the body. So every day, every person who weighs somewhere around 50 to 70 kgs should be having at least 2 to 3.5 liters of water or fluid per day. Apart from that, you have to take care of your salt intake, because It has been said that the salt intake optimally for everybody in this world should be less than 5 grams per day. But in India, it has been found that the average salt intake per day per person is somewhere around 11 grams per day. So this is very alarming. So we have to be taking care of that. We can use substitutes like we have amchur, which is dried powdered mango, basically a mango powder, which can be used as a taste enhancers. There are other taste enhancers also which can be used in place of salt. So that has to be taken care of. Then we should be remembering these golden numbers. Any female who has a creatinine of more than 1.2, any male who has a creatinine of more than 1.3 might be harboring acute or chronic kidney disease. So everybody who is 40 years and above of age should annually get their creatinine checked. And if it is found to be higher side, then they have to be consulting their nephrologist. Similarly, there's a very small and easy test which is known as urine routine and microscopy. If at all you have blood cells in urine which are microscopic, if at all you have pus cells, you have even trace of protein in your urine, that is a sign that you might be harboring any glomerular or kidney disease and you should be getting yourself checked. Sometimes with dietary modifications, we can control our diabetes to begin with. Because if a patient is in pre-diabetic stage, if the HbA1c is still not in the diabetic range, these kind of patients can, with their lifestyle, with having less salt, with cutting down on their total calories, the fat intake, the saturated fat intake, these people can bring down their diabetes to, they can reverse the stage of pre-diabetes. And if you control your diabetes, you'll definitely be controlling the progression of renal disease. So whatever are the precautions which are needed for sugar control and prevention of diabetes are the same as we would require for diabetes when it comes to this thing. Now, talking about kidneys, suppose a patient has already acquired kidney disease and we want to prevent the progression of kidney disease. In these patients, the number one thing which we have to recommend is cutting down on their salt intake. As I've already told, it should be less than 5 grams per day. And be it pink salt, rock salt, whatever kind of salt it is, all salts have sodium and we need to be cutting down our sodium intake. You need to be avoiding all the packaged food items which contain a lot of preservatives. And these preservatives, if they are like sodium metabisulfite, this will again contribute to your sodium intake in the diet. Apart from that, if at all a patient is already having CKD, his capacity of filtering out potassium will also be reduced. And those food items which contain potassium like bananas, citrus fruits, potatoes, these kind of things should be cut from their diet. If at all somebody actually wants to have these vegetables which have high amount of potassium, they should be boiling it, discarding away the water, and then consuming it. Dairy products should be cut down to some extent, I would say, because they have phosphorus. So it should be taken in moderation with suggestion and recommendations from your nutritionist. And a patient who is non-vegetarian by diet should be cutting down on the total amount of red meat that he consumes. They can take eggs and egg whites, but they should curtail the amount of red meat they have been consuming because it contributes to increased nitrogenous waste buildup and more load, acidic load on the kidneys. So these are few things we should be taking care of when it comes to diet. Apart from that, of course, if you have to prevent kidney diseases, you have to prevent overall dehydration. You should be taking small amount of water every day and in shorter intervals, because at any point of time in the day, we don't want to have a hyperosmolar state. It contributes to kidney diseases. So you don't want to have that. So we should be having a regular amount of water. You should be putting reminder if at all you tend to forget between your work. Of course, home cooked, low salt food with less oil is what I would recommend to everybody, not just somebody who has been suffering from kidney diseases.